Good evening, everybody. It is 5:32 p.m. on Monday, October 5. This is a regular meeting of the West Bend Board of Education. We recognize the quorum with all our school board members in attendance. I will call this meeting to order. Let me just get my page here, sorry. There it is. This is a public meeting of the school board of West Bend Joint School District Number 1. More than 24 hours prior to the meeting, notice of the time, place, date, and subject matter of this meeting was posted at the entrance doors of the Education Service Center and at the West Bend Community Memorial Library. A copy was also sent to the Daily News, WIBD, Milwaukee Journal Sentinel, and other media sources that have requested notice of our meetings. I would ask that our superintendent confirm that this meeting was properly posted.
Yes, it was.
Great, thank you. Let's rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you, everyone. The next item on our agenda is to approve the agenda. I would move approval of the agenda. Is there a second?
Second.
Joe Ongert seconds, and I should pause for a second. For the benefit of the record, to make sure that we get good minutes, what I'm going to be doing is just repeating who made the motions in seconds so that it is recorded for the record. So with that, thank you, Mr. Ongert, for the second. Any final discussion? All in favor of approving the agenda, please say aye.
Aye.
Any opposed? The motion carries. Thank you. All right. We have come to the public participation portion of our meeting. And I have 3 comment cards, so 3 individuals have indicated they wish to address the board. If there are other individuals who wish to address the board, I direct you to these comment cards in the back of the room. Please fill them out, because in the meantime, I will read the procedure with regard to our public participation. We've come to the public participation portion of our agenda. Board Policy 187 prescribes the natures and procedures for this segment. I summarize the policy at this time, but copies of the policy are available in the back of the room, and I urge you to familiar yourself with the policy in its entirety. Residents of the district, parents of children in district schools, and employees of the district may participate. Participants desiring to address the board should obtain and complete a participant comment card near the entry and turn it over to the president prior to the meeting or when allowed by the president. Participants may comment concerning an agenda item or a non-agenda item. Each participant will be called to the podium and given 3 minutes to speak. The participant must state his or her name, address, and relation to the district. This information will appear in the minutes of the meeting. The board will not engage in debate concerning the remarks or take immediate action. The board may refer the matter to the superintendent, a committee, or take the remarks into consideration in future action. Board Policy 872 provides a formal process for citizen complaints, and Board Policy 520 provides a formal process for employee complaints. The board recommends use of these procedures as they guarantee a fair and timely response. I will invite individuals forward in the order that I received the public comment cards, and the first one is Mark Drake. If you'd please come forward to one of the microphones and address the board. As I indicated, you'll have 3 minutes, and so as your 3 minutes approach, I'll just indicate that time is drawing close, and if you could then finish your thought out of respect for the other participants, we'd appreciate it. Thank you.
Thank you. My name is Mark Drake. I live at 2556 Pioneer Trail. I'm a member of the West Bend School District teaching here at the high school. To address the incredible proposed healthcare costs that we're likely to see in the middle of a pandemic, I chose to look at this in a different view, namely how I can increase my own pay to cover these costs, and also how to look at some of the savings options that the district has. And in some cases, I actually found that the harder I work, the less I actually get. Our HR department does a lot of things well, but I think a meeting like this should really follow a full school district meeting like we used to have back at the cafeteria with all staff brought there. And that way we could all get all the information first without hearing rumors or having some fearful thoughts. Speaking of timing, coaching contracts, I'm a former athletic coach. We always used to get them on the very first week of the season. It's now October. Why don't we have supplemental contracts for the co-curricular advisors yet? I don't make a ruckus about this because it happens every year, even though the club advisors rarely change names. In a year like this with a pandemic, we could really use some of those extra dollars at the start of the school year. As I coached throughout the years, my coach's salary increased. In the 16 years I've been a co-curricular advisor, my salary has never increased. And especially since last year, My co-curriculars lost our administrative support for our conference participation, and it hasn't been addressed again. I'd really like to get a little bit of extra money so that I can buy the conference participation for my kids so that they don't go deeper in the hole. If I'm thinking about a salary increase coming from our district, I'm reminded that last year the board did not give us the full maximum that we were able to get. In fact, we didn't get a cost of living increase last year commensurate with the rest of the economy. The new compensation model that we have is not totally accurate yet. If I'm thinking about getting a new licensure, like a reading specialist license, it might take me 5 or 6 years in order to recoup the cost before I actually realize any financial gain. On top of that, I'm told there are these micro-credentials that we can earn. We haven't seen that yet. There's a bunch of conferences that have already taken place in September, and I'd like to know who to talk to, what's acceptable, what's not, and how I can think about advancing my professionalism in that way. All of this adds to my stress level. I used to see a local acupuncture specialist here in town. The board took acupuncture out of our HRA ability, so now I don't go there anymore. So now if I can't make money, how can I save money? Let's look at some options that our district might think about. The Wisconsin Deferred Compensation Program is a 457B investing option for active local government and school district employees. As of December 2019, 67% of eligible school districts participate in this program, allowing me to invest my money, not yours, but mine, in a 457B. Our school district currently doesn't participate in this. A district-sponsored 403B plan like ours could allow for a 15-year service catch-up, allowing employees to contribute up to $3,000 per year with a $15,000 maximum. Again, this is my money, not yours. Our district doesn't participate in this plan. Some employers offer a health savings account, allowing me to put my money into a plan now that allows it to grow and invest for future health care costs down the road. I don't know if the new health care program that we have allows for this or not. So who is this going to affect? The increased cost, the increased stress, first is going to affect my students. A lot of us here, we spend our own extra money on things like school supplies for them. We make breakfast for them on the day of the AP test. We hold late night and evening and weekend review sessions for them. Something's going to have to give, and some of those relationships are going to suffer. The second group that's going to affect is our local businesses here in town. More fees and less income for me means less money that I can spend here in the community. Third group that this is going to affect is my family. That idea that I have that I must always work harder is going to have to change into a slightly different motto of work smarter, not harder. Now, I'm prepared to make cuts to 2 of these areas, but that last one is non-negotiable. Thank you very much.
Thank you for your comments. Appreciate it. Thank you for coming. The second comment card I have is Sally Hewer. If you please come forward. And also, while you're coming forward, if there are any other individuals who wish to address the board and have filled out a public comment card, you can bring those forward to the stage at this time.
I'm Sally Hoyer, 1840 Park Avenue, West Bend. I'm a community member, have been for 30 years, as well as a 31-year member of the teaching staff here at West High School. I speak kind of piggybacking to what Mark has said. I guess my question is very basic. We didn't get a cost of living raise, and now you want to increase our premiums by so much. What is my incentive to stick around? I keep losing money the longer I work here. For 8 years, those of us in a certain category were frozen, not even getting cost of living raises, and I'm taking home less and less every year. This is not what I want to be doing, and yet I love what I do. I love my job, and I love working with the students in this district. I guess I feel like I'm constantly getting slapped, and I'd like to feel appreciated, and I'd like to feel like I'm not carrying the weight of the district on my shoulders, trying to figure out how to pay for everything, because it's always coming back to the teachers. I'd just like you to think about that.
Thank you for your comments. We appreciate that. The third comment card I have is from Tracy Wells. If you'd please come forward.
Hi, Tracy Wells, North 163, West 19224, Leah Font Circle. I'm a Village of the Jackson resident, trustee, and parent. First of all, I'd just like to thank the school board and everyone in the district for the great job that they're doing thus far. As far as schooling options, I support everyone's decision on what they chose. I know it was not an easy decision to make for all the families out there. For me personally, I'm glad that I ended up choosing the in-person over virtual option after seeing some of the issues that the families are dealing with in the virtual situation. I was on the edge about which school option to choose, and both my boys have come home every day and say how awesome school is. It makes me happy to see how happy they are and knowing that I've made the right decision for them to thrive. Jackson Elementary has been doing a great job with everything, and they have had no major issues thus far. Thank you.
Thank you very much. We appreciate that. Any other individuals who wish to address the board? All right, hearing and seeing none, we'll move to the next item on our agenda, which is the consent agenda. And the consent agenda consists of minutes of the September 14th, 2020 regular board meeting, disbursements posted to October 5, 2020, ratification of contracts, and resignation. I'd look for a motion in support of approving the consent agenda.
Motion to approve the consent agenda.
Thank you. That's Aaron Dove with a motion. Do we have a second?
I'll second.
Second by Joel Ongert. Any final discussion? All in favor say aye.
Aye.
Any opposed? All right, that motion carries 7-0. Thank you. All right. So the next item on our agenda is an item really that we reserve the bulk of this agenda's time for, which is discussion regarding the impact of COVID-19 in our schools. And so I'm going to turn this over to Superintendent Jen Wimmer, who's going to introduce a guest, and we're eager to hear the report. Superintendent Wimmer.
Good evening. I don't know if Josh Shulman snuck in there, like he did sneak in. So I'm joined tonight by County Executive Josh Shulman, as well as our Director of Public Health, Kirsten Johnson. Over the past 2 weeks, I had several public meetings virtually attended by our families to gather general questions, input, etc., and have a couple pieces to share. First of all, our county executive created a public message. I'm going to go ahead and lead with that for us.
Good afternoon. For months I've been vocal about my support for in-person 5-day per-week instruction. The Trump administration and CDC issued basic guidelines and mitigation techniques to ensure schools will reopen and remain open. My office has received several calls in the last several days, contacting us asking to close schools or the schools go virtual. As expected, COVID cases and subsequent quarantines are increasing in Washington County. When the CDC's mitigation techniques are followed, schools can and should remain open in person. To keep schools open, it takes everyone following the guidelines. Now is the time to double down on our community-led approach. First and foremost, following what the CDC calls staying home when appropriate is the best way to ensure in-person instruction. Stay home when sick with any flu-like or COVID-like symptoms. These symptoms are largely the same. Stay home if you have been tested for COVID. Stay home if you have been confirmed positive for COVID. Stay home if you've been in close contact with a confirmed case of COVID. County public schools have seen symptomatic positive cases at schools, exposing teachers and other students to COVID-19. In-person instruction cannot occur if teachers are positive for COVID. Out of love for your neighbor and our children, stay home when appropriate, please. When students or teachers do not stay home under the CDC guidelines, this puts public pressure on the county and school administrations to close schools. The county will not be ordering virtual instruction. That is a decision for school boards and administrations. The Trump administration and CDC also recommend wearing masks in education settings, which are indoors or cannot provide social distancing. Students and teachers will be exposed to COVID-19 in a number of ways. Doing the best we can to mitigate the spread to keep students in school takes our entire community working together. Staying home when sick or exposed is the easiest way to keep our schools open. We know it's best for students to be in person. In-person instruction and extracurricular activities help with mental health and child abuse and neglect issues. I am asking Washington County to prove we do not need more top-down mandates and orders. We can keep our schools and economy open by following the basic CDC guidelines. Thank you.
So thank you for that message. And then this evening, we took from our feedback from our families and kind of general questions, and it's pages and pages, so some of it we'll kind of proactively handle tonight, and I'll invite Kirsten and Josh to step to those microphones, join me here, but we'll go through and we'll stop kind of through some general talking points. They've each had the opportunity to review all comments submitted through our public sessions, as well as those who couldn't make our public sessions and submitted some comments virtually as well. And then I've got kind of a natural spot for each of us. First of all, I would be remiss if I didn't start with, this is the new magical thing. Every administrator walks around with a 6-foot tape measure, and that seems to be what our lives are. I would be remiss if I didn't talk about COVID fatigue. It is a real thing. And whether it's the students being exhausted and just waiting as an administrator comes into the room and hoping it's not them who's going to have to quarantine, it's our administrators, it's us kind of, I'm sure everyone in this room where your job now is fielding COVID stuff. It's so nice to have topics non-COVID related. That's exciting, and just our families, you know, in our communities and our staff. So everyone is doing amazing work, and I applaud that, but I just want to recognize that they're really giving it their all. Our staff, you know, they got document cameras delivered last week. There were supply chain issues and put them in play within days. So I just really need to applaud, you know, the kids and their tenacity and what they're doing and how they're connecting with each other, our staff doing reach out. You know, we can always do better work. We're always working to do that together. But I just want to recognize the efforts of everyone around us and what that's doing, and just think of ways to support, think of ways to give kind messages to appreciate those efforts. So we thank you for that in our community. So with that said, we're all familiar with what COVID-19 is. We've been navigating it for months now, and we were able to, instead of a shutdown, which we experienced last spring, to open our doors and have instruction that was several choices for our families. So we selected 5-day in-person instruction, full virtual, or somewhere in between. Now, we talk a lot about transmission, and when we get into quarantines, we'll talk about what we're trying to do is stop transmission, and that's where it's going from person to person, and that's how it's transmitted. So a lot of our mitigation is around transmission. A question that we got a lot was, hey, why is the county executive involved? Or why is this person involved? Or where are you getting your information from? So it comes from several sources. It's federal and state. Any kind of guidance or orders that way, but also local. So we have our county executive who helps oversee different services, our own district and school board, and then also our North Shore Athletic Conference. So we're utilizing the guidance that is found in our operational document online through CDC, the Department of Health Services, and our public health. Again, this is Kirsten Johnson, our Director of Public Health, and she is supported by our County Executive, Josh Showman. A really big question that we get is around why does what you're using different from my medical doctor? Maybe I go to the doctor and I get a different answer. So Kirsten, if you can speak to some of those nuances and the why behind that, that would be helpful.
Sure. So I think, first of all, good evening. I should start with that. Thank you for having me. I think what's happening is we at the Health Department and Wisconsin DHS are following very closely the CDC guidance. That's what we're pushing out, and that's what we share with people who come positive or are close contacts. We are sticking strictly with the Wisconsin DHS and CDC guidance. I think what's occurring in the medical setting is these are physicians who haven't necessarily dealt with COVID. For example, today the Children's Hospital of Wisconsin, their medical director came out and gave a presentation to the community at large, but also to their own staff around what is appropriate quarantine guidance, what's appropriate isolation guidance, and when is it appropriate to test. So things have been changing rapidly over the last 6 months. We are living in this every day at my department, every day in and out. This is what we're dealing with, but there are lots of providers who haven't been dealing with this and are just now learning the differences in types of tests, what the different guidance is based on the situation or with their patient. So I think there's been a little bit of confusion there. I know the Wisconsin DHS is working to clear up some of that information. They're working really closely with our healthcare providers to make sure we all have are giving the same guidance.
One of those pieces too is not only do we connect locally, regionally, but then we look across the nation and across the globe, really, as everyone faces that, and learn from others and what we can do and how to mitigate and how to, continue to keep that range of options open. We are aware that Iowa has just made some shifts around masks. We talked with Kirsten around that. She's asking those questions at the state level. Again, our guidance that we're using is still through our state CDC and our state DHS. One of the things too is, hey, can't the county executive, can he make a different rule for us? Well, we still have local control as a school district. So we would want to use all the guidance that's being given to us, because to flagrantly kind of go away from public health guidance could open us up for liability. And the largest thing that I get as a superintendent is, okay, all right, about the learning piece, but could my kid participate in this? And could they come back in at 5 days? And we'll talk about quarantine. Jen, could you get rid of all these rules, just kind of make our own rules? We had a large spike in athletic eligibility issues over the last week. And no, I put in here because we also are part of the North Shore Athletic Conference. And as a conference, we're abiding by CDC and DHS guidance as well. So even if I said locally, nope, I'm going to pretend no rules exist, I can't field that team in violation of those guidelines. It would create forfeits. It would, everyone as a conference believes in keeping athletes safe. That's why we have limited passes, spectators, etc. So any questions around the oversight, the authority you have as a board, the different guidance we're receiving, or what we're following? Any questions?
None.
Okay.
Please proceed.
So the other piece is taking precautions. I think the hottest topic in this was face coverings. The governor just extended the face covering mandate, so we did not locally have to navigate that. But I get that question a lot. Jen, what happens if that mask mandate expires? What happens if, and again, that was extended, so we didn't need to cross that bridge, but we might have to have that discussion. So I participate in a panel with Children's Health, and going into a possible expiration of that mandate, they were still recommending face coverings as a primary mitigation step. I think that when we look at precautions, one of the biggest, I think, things that people struggle to understand or get frustrated with, and part of that COVID fatigue I was talking about, is that they don't understand if we're doing all these precautions, I'm getting as much space as I can, and I'm wearing a face covering, or I have these things, why do I still get sanctioned with having to be on quarantine? Why can't these things be enough? And again, we've left face coverings. We're abiding by the governor's orders. If we have to have a future conversation, we would bring in Children's Health, any other guidance and recommendations. But I don't know if you want to speak to, like, why do we still have to quarantine if I'm wearing a face covering? I think is a big one that comes out a lot.
Sure. So again, we go back to the CDC guidance. It very clearly says that even if you have a face covering, if you've been within 6 feet for 15 minutes or more, that you still would have to quarantine for 14 days. And I can say, even with the face coverings, we have seen spread. Up until the middle of last week, we'd really seen limited spread within school settings themselves. But over the course of the end of last week and over the weekend, we now do have confirmed cases that were contracted in a classroom with kids wearing masks.
And that is actually locally. We had our first cases of transmission at school, which I reported to our families. We do our weekly update, so those were our first transmissions at school. And I think through the county executive, his own video, he's here tonight wearing his mask, just how can we extend that grace? Maybe we don't believe in that ourselves, or we don't need it, feel that we need it ourselves, but how do we do that for our neighbor, for others, and help us remain open? Anything you want to say around masks specifically? I know that was a hot topic for a while.
It has been a hot topic. Certainly I hear about it just about everywhere I go, but I think, especially in the school setting, I've been very focused on keeping schools open 5 days a week in person, and as the superintendent indicated, we've been in that conversation dating back to July. I'm as much of an advocate for extracurriculars as anyone. I have a junior who's got his eyes on state again in cross country. and would be devastated if he couldn't do that. But more important to me is making sure that he can go to school and be there in person if he chooses to be. So masks, I think, are one small step, as are things like quarantines and isolations. I know this is a pain. I know it's extremely frustrating. I hear about it every day, not quite as much as the health department does and in the way they do, but I hear about it all the time. And it's a difficult time for all of us, but we need to be vigilant. We've got months to go likely in this process, and really you guys and your team are on the front lines of seeing it firsthand, and we appreciate that. So I know masks are a pain. I see up there everybody's doing their part, and I appreciate it.
Any questions around precautionary measures, masks, anything on this?
Nancy?
Could you, for everyone here, explain the tracing process? I'm not looking for names, don't give me the HIPAA stuff. I'm looking for, Nancy Justman is sitting next to Tawny in science class. You mentioned that you know a confirmed case was spread at school. How do you know that? How do you know these kids didn't get together on the weekend or whatever it might be?
Sure.
So could you explain it?
Let me go through some of the screening pieces, and then we go right directly into an in-depth look at contact tracing. I think that's as well a hot topic. One thing when we talk about doing your part and what we need is asking yourself these screening questions. While it's made the news that people were sending kids to school that were actually positive, that did not occur in our district. However, we have had cases where students have come to school with cases pending or not feeling well. And when we go back and do, as you said, that contact tracing, and I'm finding out, hey, there was a test pending, or your onset of symptoms was 2 days, you know, for every like high school level case, it's like 20 students who have to step out in quarantine for 2 weeks. So we really need people to ask themselves these questions and hold firm to this. And that's where we all kind of stand together in unison on doing your part and holding people accountable. So getting into your specifics around, let me just slide that back a smidge, around contact tracing. We have lots and lots of things that we do with contact tracing. So the biggest indicators for contact tracing are it's a shared responsibility between public health and ourselves. We take point on our school cases. We're on the phone with each other at night, weekends, et cetera. They're doing pieces of it in the community. We're supporting it. All of our staff, our administrators, and our nurses participate in that. The largest rule of thumb is anyone is considered a close contact if you're within 6 feet for 15 cumulative minutes. So it doesn't necessarily mean 15 minutes all at one crack. It could be 8 minutes here, you know, another 7 on the backside somewhere else. So we're looking at that. When you have exposure, so we are most often, quickest alert is through our own parents letting us know right away. And we appreciate that. The lag time between your doctor's office or your testing site telling public health to alert us, most of our cases, it's just them giving me a confirmation, and I can't speak enough how helpful that is to our families. So let us know. Do you have a test pending? We can help you navigate, or have you received a positive test? Because we will start that process immediately. We don't need you to wait until public health calls us, so call us immediately. When that happens, we then map back the last 48 hours from the onset of symptoms. That is when a student is most contagious, and from the school end. So again, we're using our public health guidance, and Kirsten can jump in at any time, but what we're doing is we're running a student's schedule, we're looking at all their contacts within a classroom, we're going around with measuring tapes, and looking at seating charts and verifying. We're asking about lunch, recess contacts for our little ones. You know, who was their buddy at recess? You know, was there anyone, teachers? We do interviews. And then a lot of video footage, specifically at high school, where I've seen a lot of video footage where, you know, we can't remember, or we look at those pieces, but we do a lot of verifications in that manner. From there, we would get a list, and then we would, you know, we almost probably all have it memorized. Hi, this is so-and-so. Your child has been identified as a close contact of a positive case. This means, and then we go through the dates and those pieces and help get them access to education. Kirsten, from a health standpoint, is there anything you'd like to add about contact tracing process, those pieces?
So I think what I would add is If we get the positive case first, which occasionally happens, we reach out to the district, tell them, here's the student, here's a date of symptom onset, or if test date, and here are the 10 days that they should be out for isolation. So we give them sort of the clinical piece, so they have all the information they need to do the contact tracing within the school setting. The other piece we do is we call that positive. So if it's a high school student, we usually talk to them on a speakerphone with their parents. When it's younger kids, usually they're talking to their kid back and forth, getting information. So we ask them, do you participate in extracurriculars? What sports? What club sports? Did you have a sleepover last weekend? Who do you as a family define as your close contacts, cousins, et cetera? We document all of that, and then we call those close contacts. And then they are quarantined based on because we reach out to them and give them guidance. In the scenarios where we've had, where we've identified where there's exposure in the classroom, the kids that have become positive were not identified as close contacts in any other setting, so no sports, no cousins, no sleepovers, no friend gatherings that we knew of, but they were sitting in close proximity to another student who then subsequently became positive. So that's how we've identified it.
What's the turnaround time that you're able to notify parents if someone's been in close contact? And the reason why I ask is because in a different county, I know a student at a high school who found out I think the student that tested positive was in class on Tuesday. She notified the school, and this student I know didn't find out until Sunday that she needed to stay home, but here she'd already been at school 4 days that previous week, and so here she was upset because she had to stay home from school, but she felt like if I got infected on that Tuesday, I've already, been interacting with people at school those 4 days. So I like the storyline that you're telling, but I'm wondering if you could put a timeline to it.
You want to speak to?
Sure. So we try to contact positives within 24 hours, including over the weekend. And we contact the school immediately when we get that information. So usually it's within 24 to 48 hours. Our goal with contact tracing, so contacting those close contacts, is 48 hours. I can tell you, for example, we got line lists at the end of the day on Friday this week. They were not called until the end of the day today, or even potentially tomorrow morning. However, we do try to make sure, so in this case, like the line list I'm talking about right now was a sports club line list. My understanding is the coaches had reached out to the family, so they're aware, but they just haven't heard from us. And part of this is, for example, we had 250 positive cases in a single day for our health department to handle. We have 100 people doing contact tracing. It's just, the volume we're just really struggling. So that's why our partnership with schools is so critical, because they have the capacity internally to inform parents immediately. So I don't think there's been a single case in any school in any of our districts that have been more than 48 hours.
Right, and so that's why it's critical, parents, let us know right away.
Yep.
So if you're pending a test, we can kind of start and be ready. But when we receive that notification, we're doing that same day. Our administrators, we're all on standby to support that. Lenny and his entire team from HR, we have a sheet that a staff member would report in. We get alerts. We were contact tracing yesterday. We do same day. It doesn't. I've been on the phone with parents at 9:30 at night, and we do it when it comes in. Kirsten called me yesterday. Here's your list of 3. Here's that. I'm checking rosters, and we're moving on it. Checking in with Lenny, going, hey, I'm aware of a positive here. Is your team on this? Yep, got it. So
we're able to eliminate the extra step if it is happening in-house, which I think is really good. Thank you.
So we, like I said, if a family calls me and said, I have a positive test, I'm going to take their word for it and start immediately. I'm not going to delay until public health calls. So we'll start moving on it right away. And that's what's really helpful for us. And then we've been cleaning up our communications. Out of the gate, it was like, wow, it takes a long time to cycle through calls, and how do we get better at that? How do we send an alert? We've got a positive case, we're making our calls right now. And then how do we alert our families in a school community? So we've got some standard communications. Hey, we're letting you know there was a positive case here, and then in turn alerting our entire school community through our dashboard, so that they're getting solid information from us versus social media, because I think it was our first case at the high school, you know, and it was within hours, it was 250 kids. It's like, no. So helping just families come to us, call, ask. Now that we have more cases, in the beginning it was too discretionary, too discreet of identifying info. We're in protection of our students and our staff members, so it can't be identifying, but we do have enough numbers where we can do more consistent updates. We're looking at kind of daily and expanding some of our dashboard elements and then getting to it that way. So we'll keep, and then I know we'll talk about metrics too, but the public health also maintains that.
So a couple comments before I get to my question, Josh. Thank you for giving us the latitude at the local level to do what we feel is appropriate here, as opposed to something impacted by a neighboring district. Kirsten, thank you for your wisdom and insight in all this. I've heard great things. In fact, that the high school plan has supposedly been discussed in Washington, D.C. as one of the leading ones in the country. I think we've had some great results so far. My question is pertaining to quarantining and the possibility, let's say, for adjustment. And I'm not sure if this is data, Superintendent, that we have here at the district, or Kirsten, if you have at the county, but I know of at least one individual, and I'm sure there are multiples at this point, where this individual's in their second quarantine cycle. So in the first 6 weeks of school, they're going to be out for 20 days. They chose in person, and that's not what they're getting. My question is, do we have the data to show, for those who have quarantined because of close contact, how many of them actually do come back positive? I'm all for, an ounce of prevention is worth a pound of cure, but at the same time, is the cure worse than the disease for these individuals? And is there something we could do for they can go get a test, and if they come back negative twice in 48 hours or something, to get them back into where they want to be, where they need to be, as opposed to, you got to run the full 14 days.
So there's a couple things. Again, the expediency in which we do contact tracing is supported by our public health, as well as when you think about county executive's role in ensuring we have the resources and the staff. As you said, you've got 100 staff members and in that support. And the next thing to unpack, as you said, is the why behind quarantine, and why do we have to do it that way, and what if I got double tests and things like that. So we have some local metrics around how many in quarantine became positive, and Kirsten can speak to that too. But the why behind the 14 days is that we don't force people to get a test, but we talk about, hey, could I get 2 tests and show negative and then come back early maybe? And the why behind that is that, symptoms can have onset, generally in that 5 to 7 day mark, but they can come as late as 10 to 12 days. So you can have this sense of like, oh, I took a test on day 6 and it's negative. And, I've got this one later, I had these negatives and I'm negative. Well, 2 days from then you could be positive, and then I have to look back to those 48 hours in which you could have, been responsible for transmission. So that's kind of the why behind the quarantine. I don't know if you want to.
No, I agree with it. Again, it's the CDC and DHS guidance that we're following. That 14-day quarantine really is the gold standard. And we have seen, I can't speak to specific district metrics. The superintendent may have that, but we are seeing kids become positive during the 14-day quarantine. And I mean, anecdotally, I think it's happened in almost every district. I don't know how many you have specifically.
Mm-hmm.
Yeah.
I think there's 2 things for you to think about in the context of that question, and context is everything. The backdrop for all of the guidance is the conversation that was happening in June and July, and that was, should we just go virtual 100% statewide? To me, that's not an option. And so the trade-off was these quarantines and isolations, which are long periods of time, and of course having back-to-back quarantines, I can't imagine for a parent or a child, would be extraordinarily frustrating. But I'll use the anecdote of Senator Johnson. Senator Johnson just tested positive on Saturday, I believe he found out. The contact that they traced it back to is his chief of staff, who had it 17 days. His last contact with the chief of staff was 17 days before Senator Johnson tested positive. He fulfilled a full 14 days. 3 days later, he tests positive. So it happens, anecdotally speaking, but more important than that, when we're faced with the decision, and the first conversation I had with superintendents with regard to whether or not virtual was where everything was going to go, really it was, we're willing to make this trade-off because the alternative of having nothing for everybody and virtual for everybody, I saw that in March. I lived it. I'm sure many of you lived it. It was a train wreck. I wasn't willing to go down that path again. Now, I'm sure we could have improved it, but at the end of the day, I think that context is really important because even that frustrated parent, and Lord knows I'd be frustrated if I were them, when they hear that, I think it does change the lens that you look at it through.
I've absolutely spoken to parents who've been impacted by double quarantine. So if you're positive, if you receive a positive, you get 3 months where you don't have to quarantine a second time. But if you are exposed outside of 3 months, then you'd be subject to quarantine again. So you could still be COVID positive and sometime down the road also be subject to quarantine around that. So when we talk about the length of time and things, we're coaching families on how to mitigate if you have it in your home, because that could be automatically a 24-day. What can you do to isolate within home so that student can access in person in 14 days? And we talked about hey, does it matter if I get a test or not? I get that. Our kids were like, well, hey, should I sit by you? Are you going to go get tested? Are you going to go get tested? That's why we don't use testing as that metric. It's all around that 14-day for onset of symptoms. I'm not forcing anyone to go get that test, but again, you could have a false sense of security in a shortened period of time for that.
So
go ahead.
Superintendent, just to confirm, if a student is in the middle of a 14-day quarantine and says, can I go get a test? I'll go get 2 tests and provide them to you. They're negative. We are still not allowing that student back in school, correct?
Correct. The only update that's come from CDC and DHS guidance, and Kirsten can speak to it as well, is as we lead into fall cold and flu season, what they did was, it used to be we were looking for kind of one symptom. They've expanded to what are the predominant prevailing symptoms associated with COVID, around shortness of breath, cough, etc. Those are really key high-level symptoms. We're still looking for one on that. But the other list of symptoms is broadened. You're looking for 2 or more of those symptoms. And then in that case, students may go to their healthcare provider. They may receive a diagnosis of something other than, and we might look for a test to confirm that, so the student doesn't have to wait 14 days before re-entry. That is the only case in which a student could re-enter early upon test results if you're proving an alternate diagnosis and still remaining negative in that. And that was an update sent to all of our families. It sits in our plan, and then on the back side of our plan, there's a chart. Anything that we touch or revise, it's segregated in that chart as well for quick and easy access. But that is the only revision that has taken place. Anything you want to add to?
I just want to add, so the symptomatic negative test is only is effective if the child's not been identified as a close contact. So if you're a close contact, even with a negative test, you still have to quarantine for 14 days.
And again,
I'm sorry, before we go on, I have another question on this. So we have kids who are now on day 28, potentially, of quarantine. So they've been quarantined twice. They've not tested positive ever. So this is because I sat next to Tawny or whatever my problem was at school. You're just sitting next to me. You're busted tonight.
But that's how kids feel. I mean,
this is where I'm going with this. So we're creating this little army now at school of I don't like Tawny because she just took me out of football, or she took me out of basketball, or she took me out of whatever it might be at this point. I mean, we're going to have kids who end up getting quarantined. Let's just assume 3, 4, 5, could be 6, 7, 8, 9, 10 times this year. What are we going to do for those students, mentally, physically, emotionally? Because we are creating giant problems at the high school right now with this. I mean, this is a problem. We have kids who only come to school. I know some of you teachers will never believe this, but they don't come to school for school. They come here for the interaction with their friends and their sports. And now we've taken away everything fun for the last 6 months. And I don't mean us, I mean the world in general. How are we going to proactively try and fix some of this? We can't give these kids back their time. They've lost out on sports, they've lost out on friends, they've lost out on important life lessons that happened to them. I mean, everyone thought last year's seniors had the worst situation ever. Well, I challenge you to say this year's seniors have a much worse situation. These kids are losing hope. They don't believe they're ever going to be able to finish their sports seasons. When we say, well, we're pushing that off, we'll do that in the spring, the kids are looking at their parents going, we're never going to do that. We know we're getting screwed out of this. So what are we, as a school district, as a county, as a health department, what are we going to do to fix that for our kids? How are we going to help them to, and don't give me any bull about this is making you a stronger person, because you know what, there's plenty of time to be strong when you're, old like we are. I mean, they don't need to be strong when they're students. They need to enjoy school and enjoy life. So I guess I'm interested to hear how we're going to fix that.
Speak from the county and public health side first.
Sure. Again, I think at the end of the day, this is about trade-offs and what trade-offs are you willing to accept. And the first thing to me becomes what we talked about back in July. And I know that's a redundant answer, but at the end of the day, it's the truth. Hopefully there will be a time in the not too distant future where that person who's been gone for 28 days is back and we're able to bring them back to some sense of normalcy. But we're not in a normal time. And I don't think anybody can trick themselves into believing we're in a normal time. We've got some of the largest businesses in Washington County that still aren't bringing their employees back at all, not just schools. So my bigger fear ultimately is that we walk ourselves into a situation, and this isn't hard to believe because if you look in Brown County right now, or in Dane County, or in Milwaukee County, they're on the verge of this, and in some cases living it intentionally, of going virtual 100%. Well, virtual 100% is, in my opinion, is a de facto shutdown. It's a safer at home of a different term. Because once you do that, now you've forced all parents to make the horrible decisions, trade-offs that you're talking about for one person, okay? And countywide or statewide. I understand that that's going to happen. It's horrible. What are we going to do about that? It's literally why the county hasn't come down from on high and said, this is what we are doing. Instead, it was a collaborative conversation with superintendents about how are we going to handle this. So I'm not sure exactly how you're going to try to rectify that situation, those individuals. All I know is I'd rather have it in a handful of cases than the thousands of cases kid-wide across the entire district, 147 schools over across both counties.
Anything from mental health with a public health?
No, I was just going to say that, as Josh said, I think having to quarantine kids is allowing us to keep our schools open at all. And I don't want to be in a position where we become more lax in our quarantine guidance and are allowing more students back in and we start to see the cases creep up within the school setting. So I think that's a no-win for all of us.
I appreciate both your comments, but I don't think you understand what I'm asking you. What I'm asking you is, what are you going to do in the long haul? You are going to have increased problems with mental health in our county. What's your plan for the future on that? What does your budget look like for next year? How are you planning to address mental health issues that are going to come out of this for students, for adults, for anyone? What's your plan? Are you increasing your budget? Are you increasing your staff? It sounds like we're...
It's certainly a society-wide issue. There's no doubt about it. I mean, and it's not just as simple as 28-day quarantines. It's way beyond that. What the superintendent talked about COVID fatigue goes way beyond school-age kids. I mean, we're seeing parents do ridiculous things that I wouldn't expect adults to do. They're doing it daily. So yeah, that's a real problem, and it's a society-wide issue. I agree. It's not something that can be tackled with the answer to one question.
And we do talk about it at the health department. What are we going to do to address what's happened through the pandemic? Mental health, economics, all of those things have an impact on long-term health. Those are things we're very concerned about. We're talking about them regularly, but at this point, our full response is just responding to the coronavirus.
Superintendent, I think most of the adults in the room certainly understand the CDC and DHS guidelines. I guess I'm wondering what training, maybe training's the wrong word, that our students have had. So if I want to avoid a quarantine, I know not to get closer than 6 feet to that guy. And I also know that if I am within 6 feet at minute number 14, I better get up and move. So do our students know that? Do they understand that?
Oh, I think that's kind of out there as we go through, and we've had some conversations, and I've talked with our principals around how are you really actively engaging kids. It goes back to Nancy's comment around how are you instilling hope? How are you instilling a sense of control? Because when you talk about the mental health impact, the things that this board did in advance, knowing that we needed to flood resources, we allocated additional dollars and hired a school psychologist. So we have a school psychologist, a nurse, and a guidance counselor on every single campus. And how do we utilize those different roles and work together to wrap around kids? Because we need it. They need it when they step out. Our staff, when you talk about the movement from spring to now and the growth and kind of the thinking of this is where, you know, I lost engagement this time with kids. How do you wrap around? Our staff are doing new things, and how do we then align different supports so our teachers can focus on building engaging instruction, keeping their hooks in those kids, and if kids are becoming disengaged, how do we move swiftly? Because that could be around a variety of issues, including mental health supports. Our counselors at the high school have stepped in, but I think in my conversations with principals is how do you empower students, no matter their age, to give them voice and control? Not just kind of the training of that, but again, for kids, it feels like it's getting done to you. I mean, for adults too, but that sense of loss of control is really difficult. So as you said, engaging in real conversations with kids around the impact and the decisions they make. I still, on days that I can go to a restaurant and I can walk in and there's all my kids having lunch together that are on quarantine. That's not a good move. I walk through, I've been officing at the high school and walk through and, you know, kids after school times, helping them to understand and helping them reshape behavior. They're hard habits. They're hard habits for all of us, but for us, we need to help reinforce and we need to engage kids in the conversation, I think, more strongly through our leadership channels. I was just talking with Principal Graff prior to walking in around, you know, student council because, you know, how do you empower kids? How do you solicit that voice? We did some group meetings with kids prior to the start of the year, and we just need to be doing that in an ongoing manner so that they can feel heard and talk about their experience in that, because we're sitting here talking about how we feel, but they really need to share openly their experience, what's working, what's not. They're creative, they have constructive feedback for us, and we just need to keep them engaged. It goes back to, I think I talked about it in the planning stages, you know, a cancellation culture where it's like every time you turn around, you are taking something away from people. And it's just, you know, how that erodes someone mentally. Again, that's why in our plans, it's kind of low, slow, staying really tight. So I'm not over-promising the world. But we're going to have to reinforce with all our administrators, our board members' comments around they've got to have some hope. They've got to have some planning of some things that are deliverable. We had a parade going. Kirsten approved our parade plan and all of that, but what we didn't want was kids losing out. The only reason we moved our homecoming parade was because we had so many kids on quarantine, we didn't want them to miss it. So we're coming up with ways to create those experiences and do things. How do you think back to graduation? People actually loved it outside, and it was great, and can we do that again? We've just got to engage them and be accountable to our community, our kids, and ourselves, that we're not getting caught up in the work of contact tracing and all of these things and operational things. We're still keeping that up front, too.
I can give you an anecdote, too, and it doesn't come from your district, but I'm sure you've all heard about this story by now. Youth football scrimmage up in Kewaskum. Coach makes a decision, even though he's positive he's going to go to the scrimmage. The most upset people on that field when I was walking off after I told the opposing coach were the kids. What they were saying as I was leaving, it couldn't make you more proud of the kids in our community. They were talking about things like, I have to do all this stuff at school and somebody walks in with no mask and now my season's in jeopardy. You know, that I'm not quoting a kid, but that's the kind of context of what they're talking about. So they're fully aware of what's going on.
Any other comments, questions around quarantine efforts? Again, negative impacts. Okay. The other piece is around metrics. So around testing, capacity for testing, those were some early pieces. The other was, what if I get a negative test? Can I still come back? I think we've talked about that with the onset of symptoms and in those different pieces. And then the creation of dashboards. We were able to unpack numbers locally with the help of public health. Again, we've reiterated to our families, those are by zip code, school-age children by zip code, because in the beginning it was really hitting maybe nursing homes, et cetera. So while our burden was high, we could look at it and go, but those aren't my kids, this isn't my local community, so how do we use those dashboards? Right now they are, again, by zip code. We're working with our public health to get those by school district, and then everyone's kind of creating a local dashboard around what do our numbers really look like so that they can make informed decisions. Or we want to be really clear, like, hey, we're starting to see fall illness come in, be really vigilant in your screening and keeping kids home proactively. So we're building out those dashboards. But I think one of the things that I wanted to bring up was around the metrics and benchmarks that have been released around high, critical, burden, and those kinds of things and closures. So if you want to speak to some of those things, Kirsten.
Sure. So there are a couple of models out there. There's the Harvard model, there's a CDC model. They're all based on the burden of disease for 100,000 people. So we have taken that burden and adjusted for every zip code in our county and our school district boundaries. We report that on our website so you can see what the burden is currently over the last 14 days for that specific area that's been identified. The levels of burden are low, moderate, moderately high, high, and very high. Until last week, the very high was critical. DHS changed the verbiage, so we changed ours to follow suit so there wasn't confusion. Very high is a threshold of 350 per the CDC. That's a very high threshold of disease burden within a community. And at that level, and to be honest, the CDC is much more aggressive. So the CDC's level is 200. At that level burden in a community, there's increased risk and significant risk to interacting in person. So whether that's in a school setting, at a mass gathering, you name it, in a restaurant. So we have, and I'm sorry, I don't know what West Bend's burden is at the moment, but I didn't look before the meeting. Again, it's on our website, but so we've laid out some thoughts for schools. So at that 350 level is sort of our trigger to have a conversation with the district to talk very specifically about their own data. Are we seeing cases in schools? What does this mean? I know in your case you opened up the virtual option again for families. So we're looking very closely at that and working with individual school districts just to provide guidance. This is not the health department's not coming down saying you need to do X, Y, and Z. It's more of a conversation collaboratively to work towards a solution so that we aren't seeing just unfettered spread in a school within their boundaries, trying to sort of regulate that in a way that so we can assure kids can continue to go to school, they can continue to have sports, but to do it safely.
And again, you saw us make moves in the last week to really draw a line to disrupt some numbers. We were just snowballing and getting cases. And again, when you're looking at our ability in our schools, I can't have 6 feet everywhere. So those contacts, again, if you're talking about a high school schedule case, that could pull out as many as 20 people. If they're involved in co-curriculars, and depending on what that is, that could pull out even more. So we started to see us having to push out about 100 a day, and we needed to disrupt quickly. So Friday was our first day after we made a move to do that where we didn't have contact tracing. We got cases over the weekend to attend to, but those kinds of things, and we expanded that this week, and we'll be in conversations with our staff and our administration around, okay, what about that worked, what about it didn't? It was hard for our teachers to have a foot in both worlds. They might all of a sudden have 7 kids sitting in their classroom and a whole bunch at home, and how do we do that more wisely if we have to look at that as a way of the future stepping in and out? So we've engaged several people in ideas, and we'll continue to do so, but we've offered that option again. Again, our goal is a swift disruption of the path that we saw that we were heading down, so that we could keep kids back in school and not have so many negatively impacted by that quarantine. Any questions about metrics, dashboards, numbers? None? So then you talked about our local numbers. So we have roughly 6,500 students. 4,635 of them remained with us in person. I'm breaking out the high school numbers just so you can see that. We have 1,700 who are still in person out of the 2,100 that we had anticipated. Again, roughly 950 choosing a full-time virtual option, 350 choosing a hybrid, which is a mix of one or more classes that they're taking online. And then 885 staff members. So when you talk about students, we do our dashboard around active cases. So we have 17 active cases of positive COVID-19. So you can see that in our in-person ratio. How many students were impacted by contact tracing absences? That's 447 students cumulatively from all the other investigations. So you can see we did 40 total investigations. 17 are currently in that positive range. Total 447 students have been absent due to close contacts. And then when we opened that up last week, you can see that our families and our students jumped on it. Last week there were 350 students that immediately did it. Today, an additional 309 self-selected home learning. Again, could be for a variety of reasons. And then people also asked, well, what about the context of other illness? Where's that at? And you can see we do have other illnesses still in our schools. And that is a little bit lower. We said, probably because we're washing hands and wearing masks and doing those things, we're seeing that. And hopefully people continue to keep kids home. When you think about staff, again, knowing we have 885 staff members, we have 19 positive cases. We've had 20 absences, 49 total associated with being in contact tracing so that they were close contacts of a student, family, it could be whatever. And then cumulatively, we've done 19 positive cases. So again, 7 are open and active right now. Any questions about our local data?
So just to understand the context there, so contact tracing absence on the students, 447, is that a cumulative number or is that a snapshot of that's what we have right now today?
That's what we've had absences due to that. So it's all the way through September. So it was from September 1, first day of school, to today, there were 447 absence students that were impacted by absence.
Okay.
It's not the number of days, that's 447 students.
Students,
for
okay.
The month that we've been in school. We've been in school 24 days as of today.
So that could be one day, it could be 28 days.
They're generally somewhere around, by the time we get it in all those, it's usually the 14, but you'll see a 10 sometimes, and then you've had a couple cases where they're double. I can unpack that and see if it's a number large enough to report who's been multiply impacted for you.
If someone's on their second quarantine, are they being counted?
They're dually stated, so it's each set of absences.
Okay.
Include students who are absent from contact tracing outside of the school, so potentially they're a household contact or close contact elsewhere?
This is, I believe in this data, it's everyone who is a close contact, whether it was school, home, at work. It's just anyone who has to be absent from school because they were a close contact. So I can unpack that to let you know how many were school related. The majority are school related, but there are some that are for other reasons as well.
Kirsten, how do these numbers look to you? Is this district our size, or of course we're unprecedented times here, but is this a positive to you? Is this alarming?
It's not alarming. I think we talked about early on this summer what percentage for us would be alarming in terms of that contact tracing absence. I think we landed around 20%. That at that point you'd feel it, and we also said that at 10% you would start to feel it, which we absolutely are in all the school settings. I don't think it's alarming. I think it would be interesting to unpack some of these active positive cases and the absence, the contact tracing absence, because a lot of them, again, are not from within the school day. It's the sports activities, that kind of thing, that are driving it.
Thank you.
So again, we're trying to unpack our local numbers. As we get more numbers, we'll look at that and expanding our dashboard and those pieces. But other than that, as I look through the sets of questions, and what we can do is, again, it's three different sets of questions that came out of our public meetings. We covered all some of the themes that we saw emerging, but open it up to any other questions that you might have for any of us.
I do have one question. Putting on your quote-unquote positive post-COVID hat, how might, and maybe I'm going to focus on vaccines, with anywhere between a 1 and 6 month period that seems to be that they're making millions of doses of vaccine, have we given any thought or to the CDC to how that's going to be rolled out? And how that would affect us locally? Like, would the vaccine be offered to the most vulnerable, to frontline workers like healthcare and teachers, and when that might happen?
So
Any idea?
Sure. So we've been talking about this now for months within my department in planning. So we have very cohesive plans around what it would look like for a mass vaccination in Washington or Ozark County. How many staff we need to do it, how many people can we get through per day, and then we have different scenarios based on which vaccine gets approved. So some of them you have to get a double dose, 28 days apart. So we've been talking about all of that internally, and the plans have been written, and we're just waiting to see which vaccine comes through first. I do think, I know that the federal government is going to come out with guidance, very specific guidance about who gets the vaccine first. And based on what we've seen so far, it's going to be those vulnerable populations, first responders, and healthcare workers. I think those are the first wave of vaccine is likely to come out in small amounts, and they will go directly to probably healthcare providers or to those first responders. It will be probably months before we're able to have enough vaccine to do a mass vaccine effort. So again, the timelines are real gray at this point. We don't know what's going to get approved first. We don't know what it's going to look like, how it's going to be formulated. Some of the vaccines in the pipeline right now have to be have to be held at incredibly cold temperatures, have to be mixed right before they're administered. Those are things that are outside the purview of public health. We don't have the resources to do that, so that would be in the healthcare setting. But we are absolutely talking about it. The state's talking about it. We have our plans we are set. So we have a good idea of what we're going to be doing, but we're really waiting on to see what the first vaccine is that's approved.
Kirsten, could you speak to, I'd be remiss if I didn't note that Wisconsin is a personal conviction state regarding vaccines. Can you talk about the implications of that for our state?
Sure.
As well?
So people can choose whether or not they want to be vaccinated. And it's going to be completely up to our families whether or not they choose to have a vaccine. I should also mention that none of the vaccines that are currently in the third phase trial have been tested on kids. So it's highly unlikely we're going to have a vaccine for children. I would hope that we have it before the next fall. I don't know if we're going to, because currently nothing's being tested on children. So right now it's just for adults.
Could you speak to the percentage of Washington County residents who actually get the flu vaccine on an annual basis?
That's a really good question. I don't know what the number is off the top of my head.
Would you assume it's less than 40%?
It's probably right in the 35-40% range.
So just pointing out that 1/3 of the population gets a vaccine that's been around for, 40 years?
It's absolutely going to be a challenge.
Right. So the idea that anyone besides first responders is probably going to line up for this, besides Chris Swigart, who said he was going to line up, probably slim to none. So maybe you could speak a little bit to what kind of plans are you making on how we'll learn to live with the virus like we do with other viruses and other illnesses that are out and about?
That's a great question. So we've talked internally within my department, what is this going to look like a year from now? Are we going to continue to do this level of contact tracing, contacting positives, the quarantine and the isolation? And this is my total crystal ball, I'm imagining that this is going to become something that's similar to how we follow up with flu. Within the local health department, we follow up on, the only data that we really get is child flu deaths. We have very little interaction, and I would imagine that this is going to play out in a similar way, that this is going to become a disease that just exists within our population. Those who choose to be vaccinated, choose to be vaccinated. Yeah, but again, my crystal ball, I'm not sure how it's going to look.
But that question and that answer underline, I think, what really is the bottom line is that we don't know.
Right.
And when humans don't know, they get really scared and they just start to do strange things. And I think this was happening across the country. And I think two things are going to help solve that. One is a vaccine, because we think that there's some kind of solution, even if we decide we don't want it, that's an option. And the other is when this presidential debate is over. I mean, we hear about it every single day in context all the time. I'm not saying this thing's going away. It's not. There's no doubt about it. I think Kirsten's exactly right. We're going to live with this for years and years and years. But it's in our face all the time right now. And until that stops, this conversation, these types of presentations are going to keep coming at us. And I think the more we can be vigilant in following the guidance and stuff like that, you're really just trying as elected officials to keep people calm so that we can try to live a normal life.
Any other questions or feedback from board members?
Kirsten, the state of South Dakota, state of Nebraska, state of Iowa, their DHS have recently come out with other guidelines that I would say are much leaner than the CDC. Do you think that, or maybe this is a question for Josh, do you see that the state of Wisconsin DHS could potentially do that? Is there any talk of doing that here in Wisconsin?
I can answer that. I have no hope in our DHS doing anything like that. I think we've relied heavily on CDC guidance, like very heavily on CDC guidance, and have gone out to people who have been affiliated with the CDC and the FDA. Kirsten mentioned the Harvard study, the Harvard data. We went there, not DHS.
AEI.
Yeah, AEI, American Enterprise Institute. We've utilized them. So it's not because we don't have faith in our institutions. We do. It's what we're seeing, the consistency and the reliability is coming out of the CDC and Harvard and AEI. And politics is taking over in other places.
And I would also mention there are other states who have gone way stricter than what the CDC has put out. So it goes both ways, depending on what state you're in.
But I think it's worth mentioning that you can even look county to county in Wisconsin. Dane County is extremely locked down compared to what we are. Their burden rate is higher than our burden rate. Milwaukee County, Brown County. So people have been criticizing the community-led approach and people trying to do the right thing. I don't think there's an answer. I think what we know is we don't know. We don't know what this virus means today. We don't know what it's going to mean 2 years for the people who got it, for the ones who didn't, and maybe 2 years from now get it. We just don't know, and we're just asking people to try and not to get it and try not to spread it.
Kirsten, you heard the superintendent talk about issues that we've had, and I'm sure this is in multiple districts with parents sending children to school that are sick. Would you consider that to be your number one ask from parents as to what to do to help break the cycle?
I think so. There's a few things families can do, but I think first and foremost is please don't send your sick kids to school. It really is critical, even if you think it's just allergies, that you get that diagnosis that those kids can come back to school, but we've seen time and again that these kids are symptomatic or sent to school, and then it results in these huge quarantines because those kids have been exposed to many people. So I think asking families to be vigilant, I understand the economic burden aspect of this too. People who need to send their kids to school because they need to go to work. I absolutely get that, but I think if we want to keep our schools open, we can make sure that we aren't sending sick kids to school. I think we can get our kids tested so we know if kids are asymptomatic and are potentially spreading it, so we can stop some of these sleepovers events happening after school, club sports, stop the spread in those settings. I think that would help as well. Wearing your mask, I know that's controversial, but I really think that is a frontline, easy mechanism to mitigate the spread. And I think we need our parents to model that behavior so that our kids are doing it too. Again, I think kids are doing a great job. I can't express how much I appreciate what our schools have done, because I've read all of the plans, and there's been an incredibly heavy lift from the administration down to the cleaning staff and everyone in between. They've done a phenomenal job, and our kids are really like Josh mentioned, they know the rules and they're trying to follow them because they want to be there. So I think they've done a tremendous job. But yeah, please don't send your kids to school per se.
When the phone call comes that my kid's been in a close contact, does that come from the county health or does that come from the school?
It could come from either one of us, depending on
The scenario.
Who's doing the contact tracing and things. When you make that phone call to the parents, do you tell them, look, Joel, I know your kid might feel healthy and might want to go outside and play with friends, but you can't do that? I mean, do you instruct them like your daughter can't go to dance for the next 2 weeks? That's made very clear to people who are close contacts.
It's made very clear.
That is made clear. What's really nice is we're starting to get our older students asking us for letters of verification of quarantine because their employers are supporting their wages while they have to miss work as well. So we're happy to do that too, that they understand that you shouldn't be going out into those other places if you're subject to quarantine. So we're happy to support that too.
Other questions for our guests and for our superintendent? I just want to extend the board's thanks to both of you for coming, for your service to our community. We realize this is a long battle, and we sure appreciate having you on our side. Thank you for that, and thank you for the time you took to come to visit us tonight. Appreciate it very much. Thank you.
Thank you. Thanks.
All right, Superintendent Wimmer, the next item on the agenda would be your report.
Yeah, might as well stay right here. As you're giving thanks to other public servants in the room, we would like to extend a thank you to our school board. It is the Wisconsin Association of School Boards week, October 4th through 10th. We want to thank you, our 7 school board members, for being strong advocates for public education, our West Bend School District. Each of you selflessly devote your knowledge, time, talents as advocates for our students, staff, and families, and it's certainly not easy times to do that. You are responsible for formulating school district policy, approving curriculum, maintaining school facilities, navigating pandemics, adhering to state federal education law. As we know, it takes strong schools to build strong communities, and you devote countless hours to making sure our schools help every child learn at high levels. So thank you for staying the course, making tough decisions, spending those hours studying educational issues, regulations in your effort to serve our larger community. So on behalf of our staff and our community, I would like to thank you for your service as well. So the update is non-COVID related. I'm really excited when we talk about seeing kids in schools, and they're excited to be there. We're excited to have them. We've been participating in high school level athletics. I know our middle school group has had some conversations and delayed. I don't have a definitive start date for our middle school athletics yet. I will get that, and we'll make sure that families are aware. But we have several teams who've been in competition since this summer. We have co-op teams, so that means it's a blend of East and West together. So our Trail Sharks mountain biking team has been taking the opportunity to refine their skills through practice as their competitions were canceled due to the pandemic. Our girls swim and dive team recently beat Homestead, Whitefish Bay, and Nicolet. I've seen the girls swim and dive a couple times. And girls golf had a great season, and East student Haley Matner has advanced to the WIAA sectionals, so those are a co-op update. And both teams, our dance teams, were happy to be performing during soccer matches, our football games. Our cross-country teams will compete in the North Shore Conference meet this Friday. And athletics are working to live stream our competitions because, again, we're adhering to limited spectators. It's direct family members. People have passes that they receive. So we appreciate that on behalf of keeping our athletes with minimal contacts and keeping them healthy. So again, our West Bend Community TV live streams our home varsity football games on its YouTube channel, and then check both the East and West athletic departments for their live stream information for swim, dive, soccer, and volleyball. So we've actually had shout outs. It was interesting. People were watching from across the country, the football game the other night. You know, grandparents who might live out of state are able to watch those as we move to a new format of live streaming. So that's been exciting to watch as well. And East Athletics, the girls' tennis team, has been going strong all season, and today is competing in the WIA subsectionals. The football team is coming off a 35-10 win over West Bend West and currently 1-1, hoping to make the state playoffs for a school record 5th straight year. Their JV football is 2-0 on their season, beating Whitefish Bay. Most recently, the girls' cross-country team took first last week at the Nicolay Campus Classical Invitation. And late in summer, East Athletics was named WIA Award of Excellence recipient. And that was the first time a West Bend High School received that designation. For West Athletics, the girls' tennis recently beat Slinger 5-2, West Bend East 5-2, and they're competing in their WIA subsectionals today as well. Our JV2 football team beat Homestead 21-7. Varsity football is still looking and chasing that first win, but we did make history with a first ever female kicker at West, Lindsay Justman. So congratulations to Mom. I don't know how parents do it. I was just standing there watching a history-making student on that field and just with bated breath on that first kick, which she nailed. So congratulations to Lindsay. It was really exciting. That game was featured with Fox 6 as the game of the week as well. Our girls cross country and West took first place at the Brookfield Central Invitational. Boys cross country, JV finished first in the Jamie Block Invite, and varsity finished 5th. Girls volleyball is 2-1 with wins over Port and Slinger. Boys soccer tied with Hartford over the weekend. So while our co-curriculars and clubs might look different, maybe they're virtual, maybe some are delayed, maybe some are really hands-on and we just can't do those things, we're engaging our kids in, you know, what can we create? Maybe there's a club that hadn't been in existence before, and we're really open to those ideas as well as administrators, you know, at all grade levels, work with kids to be creative and innovative and figure out what they can make that look like. So it's really exciting. We look forward to, in the future, generally, we have students come and present to our board. So I was presenting on their behalf to kind of let you know what was going on in their schools, but we'll be re-engaging our students. I know at our next board meeting, we have a student presentation as well, but we'll get our student representatives here at our board meetings too. And then our next big day is October 12th. We have a professional development day for our staff. When you talk about what it takes to really pull off what our staff is accomplishing right now, whether it's living in an in-person world, a virtual world, we spent a lot of our time leading into the school year focusing on giving those professionals the time that they needed to do what they needed to do to plan instruction. They really needed to rethink every moment of a child's day, create new routines for themselves, for others, and our October 12th professional development will be in support of their work to create distance learning and just unpacking instruction and how that looks differently as well. So those are some highlights.
Great. Any questions for our superintendent with regard to her report?
I don't really have a question, but just a couple comments. I loved watching the homecoming game from my couch. It was the best weather of a homecoming game I've been to. And my kids said the same thing, though they didn't like the company. And then my second comment is I have 3 kids in the high school, 2 of which were quarantined last week. And the pivoting that the teachers did to keep them engaged, live, real time, in their classroom was so appreciated. It was a million times better than spring. And I know I'm not the only one to say that. I have plenty of friends in that same demographic, and I'm getting text messages on how much better the instruction has been last week and the end of the previous week and then going into this week. My kids are in school this week. That's where they want to be. But they did enjoy their small class sizes today. So just a couple little feedback. I really appreciate the high school teachers.
Thank you. I know that everyone appreciates any kind words. Our staff, many of them I talk about, you know, do you remember that first year that you taught, you were kind of oblivious? And so looking back, you know, maybe a couple of years later after your first year, like, wow, I do this and this and this so much better. And it's like, we had to give ourselves permission to have our first year over again. There's so much that they want to be and so much that they want to do. And right now we're modeling for our students what it looks like to be a learner and learning some new tricks and doing that. So again, we applaud them and thank them as well.
Other questions, comments? All right, thank you. The next item on our agenda is consideration of approval of 2021 employee health and dental insurance premiums. And Mr. Lenny Hansen will be guiding us through this. Mr. Hansen.
All right, so thank you, Board, for having me back again. As you recall, at our last meeting in mid-September, we had a little bit of a lengthy presentation about our health plan performance in the 2019 year. After that, we talked about both performance from the health perspective of how effective our entire health insurance and wellness program is at supporting our employees' health, as well as then we looked at the performance from a financial standpoint. Following that presentation, I then presented the proposed health and dental premiums for the 2021, so next calendar year, for employees. We would take two separate votes on those as the first, before we get into the details, kind of a protocol piece. We'd take two separate votes on them just to have a clean process there. As you may recall, the dental rates are proposed to stay flat due to strong performance by the dental program and no projected increase in the cost of dental insurance during the 21 year. And then the health rates were proposed to see an increase for two primary reasons. So Assistant Superintendent of Finance and Operations, Sarno, and I have spent a lot of time with our insurance broker looking at various scenarios, and really there's two pieces that the premiums are designed to address. The first is a projected roughly 5.8% increase in the cost of care next year, kind of industry-wide. The second piece, which results in the increases being larger than 5.8%, is the fact that over the past about at least 3 years, as we did our analysis, we noticed that the cost share between employer and employee had been drifting more towards the employer than at the previous benchmark kind of set by the board and been in place for quite a while, of about 10% share for the employee versus 90% for the employer, and that had been drifting away from where the board had previously long ago indicated that they would prefer it to be. That's probably for a variety of reasons. As you're no stranger to, we've had a number of different superintendents, HR directors, and finance directors in that time period. So we're trying to do some gradual shifting back towards where that goal has been. So that brings us to the rates that were proposed. The rates for both dental and health would go into effect on January 1st. No matter what the board were to decide tonight, we do need to come out of this meeting with a decision because open enrollment is in November. So we can discuss your thoughts and that sort of thing as we go, but I do need to leave tonight with approved rates that we would go forward with because we have to start preparing for the open enrollment process, which starts in about a month. In terms of some of the key questions, I mean, I really do appreciate Mark and Sally coming in. I think it takes a lot of courage and engagement to come in and speak your thoughts about what this very important decision. Did have a couple of proactive conversations with some staff leaders about this. Had positive conversation. I shared with you the communication that went out to all staff a number of weeks ago so that you were aware of kind of the same communication that we had sent out to staff following the last board meeting. We didn't have anyone reach out to us with questions. It gave a way to contact us. That's okay. We know this is something that people need time to think about and appreciate people coming tonight to speak about the topic. Really, the discussion ends up centering on not necessarily what is just, but what is our core driver here as a district in terms of cost share, and and then long-term plan design, right? Because when the costs of healthcare go up, it affects both the employee and the employer. And if we see that, you know, from the employee side, that the cost of the premium is becoming too burdensome, then that's also a sign maybe we need to look at the plan design to see is the overall delivery of the program becoming too burdensome in general. So there's a number of factors to consider there. As you may recall at the last board meeting, well, at the end of this discussion, I also talked about that we want to convene a benefits review committee of staff members and really use that committee type process moving forward to make decisions not just about premiums, but especially about plan design. We need to better understand, aside from just taking surveys, what elements of our insurance offerings our employees really like and engage with, and which ones are not impactful to them. That'll help us refine our plan, which really the plan design hasn't been significantly altered in a long time, aside from the elements that, I can't remember if it was Sally or Mark brought up from a couple of years ago when the district had a somewhat sudden budget shortfall prior to this Superintendent Wimmer, myself, or Mr. Sarno being here, and some changes were made somewhat last minute to the HRA plan and what you could use HRA dollars for. So knowing that that's the only change that's taken place, and then at that point also a co-insurance was added, 10% at that point. Aside from those elements, there hasn't been a significant movement in the plan design, and I think it's time for us to bring that staff committee together to really analyze that. So, you know, I'm prepared to talk to you about all kinds of different long-term options, short-term options, but at this point, we have the two proposals to vote on tonight, and I'm open for all discussion around that.
Thank you. Because we're self-insured as a district, can health savings accounts or HRAs, can we create something like that? Or can you tell me more about what options there are for employees to be able to save up for their own expenses?
I'm sorry, can I just interrupt and do a point of order? Could we get a motion on the floor first so that you can open discussion?
Thank you, Superintendent. That is a good point. I'd entertain a motion in a second, and then at that point in time, we can open discussion. I appreciate that.
Should we start on the dental rates?
Yeah,
If that's the case, that's probably a simpler
I'll make a
conversation.
motion on the dental one because I think that's a simple, there's really no change to the dental plan from last year. So I will move to approve the 2021 employee dental insurance premium rates as presented.
Motion and a second to approve the 2021 dental rates as presented. Any final discussion? Hearing none. All in favor, please say aye.
Aye.
Any opposed? Thank you. The motion carries 7-0. And just for the benefit of the record, Nancy, I think you seconded that, correct? All right.
I'll
Great.
move to approve the 2021 employee health insurance premium rates as presented.
I will second that. Motion and second to approve the 2021 health insurance rates as presented. Discussion. Any questions?
Tani, we'll turn it back over to you there.
Tani,
We've got a
please.
motion there.
I think, was there any more than questions?
Nope.
Okay. So we offer an HRA, not an HSA with our plan. I'll give a little bit of detail there. So our HRA has a variety of levels depending on which plan you choose, single plus spouse, or family. Our most popular plan is a family plan that has a $6,000 deductible. If you complete the wellness components, you receive $3,000 in HRA money from the district to offset deductible and co-insurance. We also allow you to roll over HRA dollars for up to $9,000 in total. We do not offer an HSA. It's not something that's been looked at in a while. One of the primary reasons I believe that HSA has not been looked into is since we have a free clinic, there's a number of federal laws that get very hairy between offering free medical care and an HSA. If you offer an HSA and a free clinic, you end up having to track the cost of every person's usage of the clinic for yourself, And then once they surpass, I believe it's $500, then they can use the clinic free of charge, but it gets pretty complicated, and I think that's probably the reason it was not looked at, and that an HRA was selected instead when they developed this plan design back in, I think, 2013.
Okay, I mean, that makes perfect sense. That's a very reasonable explanation, and I think it's generous of the district to front load the HRA, and maybe we just need to explain why in better detail, why we don't have the HSA option. Because, I mean, it is great that we have employees that want to save for their future and be fiscally responsible. So, yeah, I mean, they deserve to understand that better. Thank you.
The HSA certainly have the advantage of they can travel with the employee versus an HRA, so there certainly is a benefit to them. But again, we really have to review how we utilize our clinic if we started using an HSA. If possible, it just has to be reviewed.
And I believe overall, the HRA benefit and, like you said, the free clinic, I think if you were to make an apples to apples, that would still be a very good benefit.
I should also point out the clinic is not paid for out of employee premiums. That's a separate district benefit. You could consider that an entirely separate district expense. Like, for example, we purchase life insurance for all of our employees, and the employee doesn't shoulder any of the cost for that life insurance policy. So the clinic is really an additional employee benefit, not supplemented by premiums or by the employee.
Lenny, I'm going to be voting in favor of these premiums as presented tonight. However, I love the idea that you're going to be taking a deep dive into this next year or later this year, putting together a team to look at the design of the plan, because you can't lose sight of the fact that this is a very rich healthcare design. So when our employees say that I'm paying a lot out of my premium, well, that's because we're giving you a lot. And we're giving you that on-site health clinic. We're giving you HRA dollars. We're giving you low out-of-pocket maximums. We're giving the employees things that right now we haven't taken a look at in a long, long time. I think it is time to start asking employees, you want your health care costs to go down? Great, your maximum out-of-pocket's going to go up. We might start charging you a copay to go use the freighter clinic and not have a free on-site clinic. We may be able to open up an HSA by doing that sort of thing. So I understand, some of the emails we've got from people enrolled in this plan, some of the people commenting tonight, but we can't lose sight of the fact that we are offering our employees a very, very rich plan, a rich design plan. And I've said this year after year. I work for one of the biggest companies in the United States, and my plan is nowhere near this. My wife used to work at Kohl's Corporate, a $20 billion company. Her plan was nothing like this. I talked to friends around town who work at Harley Davidson or at Target. My wife used to work at Target. That's an $80 billion company. Her plan was nothing like this. So our employees can't lose sight of the fact that what we're giving them is very good. If they want that changed, that's where this committee comes in next year, where we really take a deep dive to see what they want in a plan. Do you want lower monthly premiums? Do you want to continue with a rich plan? That sort of thing. So for now, I'm voting in favor of it, but knowing that you're going to put that committee together and take a look at it. A couple other pieces while I'm talking. Maybe we offer a cash in lieu of if you don't want to be involved in our plan, or if your spouse has a plan that you are declining a spouse's plan to be on our plan, maybe you offer a surcharge to that person for doing so. So I mean, there's a million different ways you can look at healthcare. And it's time that we really take a deep dive and look at it. So
I guess two of the key metrics, that any employer would look at, including us, is the participation rate in the plan. We have an extremely high participation rate. 88% of our eligible employees take our plan. That likely means that we have a pretty favorable plan compared to maybe what a spouse, if the employee is married, has available to them, right? So it's a competitive plan. You're right. It is a good plan, and I think our employees agree with that. I never hear people saying we have a terrible health care plan. I think people appreciate that, and I think that some of the, comments that, either email or that we may have heard are more about the increase and amidst, tough economy and things like that, and I completely empathize and understand that. I'm on the plan myself. I'm proposing raising it for myself as well. I understand what that's a significant impact for a family. So the participation rate is the first one, and we have extremely high participation, telling me we've got a good plan. The second thing I would look at is our employee turnover rate. Obviously, the entire point of any compensation element, pay and benefits, is to attract and retain great employees. Consistently, year after year, the best comparable number I have is teacher turnover rate, and our teacher turnover rate is strong year after year. 3 years running, it's at between 6 and 7%, and we get comparable data from other districts, and that beats most of our neighboring districts. So does that mean that everything's great, hunky-dory, and we can't do anything better? Absolutely not, but it does tell me that our compensation package at least is doing something to retain our staff. We can certainly improve it and make sure that it's even more tailor-made to what our specific staff wants. But those are 2 key metrics I'll look at. The only other thing, you talk about the richness of the plan. I mean, I think it does attract staff, and I'm glad that we have a plan that has a lot of great benefits. We do have one of the lower out-of-pocket maxes of our nearby districts. Co-insurance, co-pays are on the lower end compared to some of the comparables. I think that factors into why we have great participation rates and why we have great turnover. And it's good to have those things, right? But I think you're absolutely right. It is time for us, after probably 7 years since we really looked at plan design, to get out there and have some in-depth discussions with the staff about what they want in their plan.
Lenny, could you, I know you do a really good job of this, so I have first a comment and then second a question. So I can appreciate no one likes their premiums going up, but hundreds of thousands of people have actually lost jobs this year, and hundreds of thousands of other people have taken pay cuts in America, as well as seen, their premiums increase. So many other industries are seeing a double or triple whammy to their effect. So I can appreciate no one likes it, but unfortunately, it's also the situation we find ourselves in. Could you speak to how other districts in our county, or not necessarily our county, but maybe in our conference, whatever you'd like to use as a metric, but where do we fall in line? Are we somewhere in the middle with our premium costs, high end, low end?
I would say we are mid, maybe slightly above, because the overall cost is higher than our neighbors. So our overall cost of our plan, as Joel said, is extremely rich. So in terms of percentage share, I think we're actually very competitive, maybe a little bit on the lower end, but we have a very rich plan. And we're seeing the effect of that with increasing premium rates. Does that answer your question? Okay.
As you do assemble your committees next year and do your deep dive, which I'm very grateful you're doing, I really want it to be something the employees want. That I want them to design it. I want them to get everything I want them to be informed about what the choices are, but I want them to own it. Because, I really like the board that we have up here, but 5 years from now, we don't know who's going to be up here. And they could sit up here and just dictate to them what they're going to get and what they're going to pay. So I want them to be, I hope that you can assemble a committee set of questions, surveys of the staff who can't attend these meetings. I just really want them to embrace whatever they choose to put together, and we will get behind that, I'm sure of it.
I think that, like I said, in addition to the 5.8% expected increase in cost, that cost share piece is really important for avoiding kind of the scenario you talked about, where maybe a different board comes in with a very knee-jerk reaction, right? So if we stick to ongoing and long-standing board drivers, then I think we're likely to have a much more even experience from year to year, regardless of turnover in the board or what takes place in the health insurance market. It's important that we stick to those drivers, which unfortunately in a year like this year means a larger than just the healthcare cost, healthcare inflationary cost, but it gets us at that cost share driver that I think is long-term important for us.
Any other discussion? Hearing none, there is a motion on the floor and a second to approve the 2021 employee health insurance premium rates as presented. As discussion is over, I will call the motion. All in favor signify by saying aye.
Aye.
Any opposed? Thank you. The motion carries 7-0. We appreciate your help, Mr. Hanson. Thank you.
Thank you. And again, I do want to thank the staff that have spoken tonight and reached out. It's supposed to be a hot button issue. It's supposed to be important. People are supposed to be passionate about it. So I appreciate the engagement from everybody.
Thank you. All right. The next item on our agenda then is our board meeting calendar. And the next 3 meetings of our board will take place on October 26, November 9, and November 30th. And we'll need to watch the future notices to see if they'll take place here or if they'll take place back at the ESC. So watch your future notices. Are there any other items for follow-up and communication? Or any other items to come before the board? If not, I would consider a motion to adjourn, please. So moved. Motion made by Joel. Second by Nancy. Thank you. Motion and second to adjourn. Final discussion? All in favor signify by saying aye. Aye. Any opposed? None. The motion carries 7-0. It is 7:18 p.m. and we are adjourned. Thank you, everyone.